That was like the preview. Hi guys. The next one would be don't get stuck, like I just said. Use the mark button to take the something off your shoulders. And you know what? Another thing that really did help me was one question would actually answer another question later on. Like, oh, this person with pernicious anemia and paresthesia. So I was like, yes. And I go back and I find that other question that says the symptom of pernicious anemia is, and then I get it. So sometimes that's a really good one. If you're unsure, you can put the mark button. Doesn't mean you have to come back. Just always answer the question. You'll never get a 0 for guessing. And hey, you have a 1 out of 4 chances of actually getting that guess right. Those are some good options for me. The next one is avoid choosing exotic diseases, right? We all love exotic things, but we can't say that they're good for this situation right now. Because like I said, this is like a general hospital. This is like a primary care clinic. So don't expect someone to come in with suddenly something sticking out of their shoulder, right? That there are questions like that, but that's for individuals that are taking a hospital exam, right? So avoid exotic diseases. Remember that there are primary care conditions, and don't add information, and keep it at face value, right? Like the question I just gave you before. Don't add, oh, what if he's old? What if he's a woman? What if da 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 da? Right? It could be BPH. I'm going to get another example. Right. So a pregnant client is having, remember I told you about the pregnant? It's gonna come. A pregnant client is having a non-stress test, an NST. It is noted that the fetal heartbeat raises 20 beats per minute, lasting 20 seconds every time the fetus moves. The nurse explains that A, the test is inconclusive and should be repeated. B, further testing is needed. C, the test is normal and the fetus is reacting appropriately. Or D, the fetus is distressed. With my decade of knowledge, I can still say that I would be completely, at least 80% sure of this answer, right? Because I'm not a specialist. It's not going to be something that I'm going to be like 100% on. I would put a mark on this. And then hopefully later on, I'm going to have another question that has to do with something about a non-stress test. And in the question, they're going to answer that question. You know, that's what I would do. But the answer for this, just so I don't leave us on the cliff, is C. We're going to, the test is normal and the fetus is reacting appropriately. You would know this if you know the normal test values of all your tests, right? They're going to, that was what that was. It was knowledge based on tests and reading notes. And if you're not in a real situation, you don't do something like, I'll be right back. Let me find the doctor. You're going to give her a heart attack unnecessarily, right? So that's why it's really necessary to understand what all these things mean. Moving on to the next one. I'll just put that, no exotics, even though I love exotic. And if anyone still needs time to look at these, I'll get my head out of the way. So another note is take your bathroom breaks. Very serious for me, at least. I took my bathroom break. It was allowed me to reset. And if I did spend another hour, it would have felt like I just sat back down. And it doesn't get you too frazzled. Breathing, exercising, positive talk, like we got this, and not, oh my effing goodness, you know, like we got this. You tested for this, you're ready for this, right? So I'm going to take this time to start reviewing some questions, some practice questions, or we can talk about this. All right. So a few notes that I saw here. Review timelines for the individuals that are that now have graduated. A thing about graduating that I want to make sure I have individuals realize is that when I finished, after the whole, you know, passing the stage and everything, it got really quiet for me, right? I didn't have to go to class anymore. My classmates weren't really checking on me anymore. So it became difficult for me to even sometimes concentrate or get back around the fire and flame. Sometimes that does become either keep students that are still in the fire, go ahead and bother your graduates. Still make sure they're in the fire and that they're not letting life prioritize themselves over what we need to do, pass this NCLEX. Woo! So when you're studying, you can prepare a study schedule by organ system. You can easily get this online, and they can give you a timeline. Give yourself maybe every week to complete everyone. After I graduated, I didn't wait too long. I graduated in December, like December 20th, and then I passed the NCLEX like January 6th. I didn't really play. There was like a minimum of 15-day waiting period, and I was like, let's just do it. So, but if you need more time, you can start your studying or reviewing for a test at least 3 months in advance, right? You can start taking those cram courses 3 months in advance just to be consistent and alert, all right? So now let's get back to some of these questions. I want to find a select all that apply question. All right. Okay, I'm passing by a lot of good questions. But just let me know. Actually, this is giving me a bit of an interesting situation. If anyone would like to have a cram session, you probably do have another a nursing student professor that is amazing at it. But if you would like to have some fun times with me, and I can give you some weird, quirky ways of remembering some of these body systems, we can go over that. Someone said they're interested in seeing the flashcard again. Okay. So the flashcard was me taking the scheduling of the body systems and literally going through it every day. And thank you. These are my holiday nails. Yeah. All right. So, right. These are not nursing nails, just letting you know they're holiday nails. I will get them short once again. My mother, she's a nurse as well. So she made sure she got on my behind on the proper appearance of a nurse and hair away from the shoulders and everything and the earrings. Just letting you get on that. So the first one were the labs. I tried to get them all inside of one, but I wasn't able to. But when I'm taking my notes and I'm putting it in like a bigger book, I definitely try to make them all list in the same time. When the test comes, sometimes when you get frazzled, you can't remember anything. But as a question comes in, it'll come in like a little block of information, and you'll be able to put it down, right? These you can get them at any Office Depot or whatever, Office Max. I think they absorbed each other. The topics, I'll tell you the topics, right? I have the labs, cranial nerves, and if I'm not mistaken, these are also in alphabetical order, just about. Cranial nerves, endocrine, and the way I did the endocrine was like versus each other. I like to think about these as individuals, like two different people, you know, the big bloater and the pink puffers and stuff. I also put Graves versus Hashimoto's. I think of them as the what are those guys called? The giant Chinese people, the sumo wrestlers. Yeah, I think of him as a sumo wrestler, Hashimoto. I have the endocrine signs, dermatologies, like the actinic keratosis is a premalignant squamous cell carcinoma, and like that's one of the most common ones I would always see in the question. So I just said actinic, right? Something like that. I have the GIs, and that's front and back. I have everything like metformin and how it causes diarrhea and nausea sometimes. I also have musculoskeletal, which that one was 2. I had one specifically for RA versus OA, rheumatoid arthritis versus osteoarthritis. They would love to ask questions about that because they want to know that you know the difference of it. And the biggest difference is one is unilateral and one is bilateral. You know, one is better during the daytime and one is worse at night because it's overuse. It gets worse over time. There's neurological, there's the nutrition. Yes. The question of like what blocks absorption, because that might be an educational question. Calcium, bicarbonates, coffee, whole milk. T. Respirations, I had that in 2 different, because it's lower and upper respiratory. STDs, I also has that as 2 because there's just so many. I have if you guys want to go on my YouTube channel, I have some of the classes that I tried to teach before. It's characterization of the disease process. As you can see, my mind is very cartoonish. It's like animated, and I love to imagine my disease processes as people. So when I see them, I can imagine them dancing in my head while they're telling the story. And does this look like this person? No, you know. But in the YouTube, it's tea time with tea, like TEE, tea time with, yeah. So if you look that up, I could actually put it right here. On YouTube, it is. And then I'm going to do a third one. I had a long time with it because YouTube kept kicking me off because I kept saying stuff like gonorrhea, chlamydia. I guess they didn't like that. But if you look up my YouTube channel, you'll see when I have one for chlamydia, her name is Callie, and for gonorrhea, her name is Rhea. And like, yeah, one's a raver and one girl likes to be on a bicycle, which just mostly means that she gets treated with doxycycline. So it's really fun. Another one I have here is the Tanner stages. They're going to want to know that you know the Tanner stages, even though I haven't really had to use that for a while, but that's because the type of pediatric issues I had to deal with was not of that concern. I also have the types of tests, diagnoses, and labs, like the ankle brachial index or like a positive hepatitis C. They're going to ask which one means that it's positive hepatitis C, and it's the hepatitis C RNA, right? Or the H. pylori, the urea breath test. You know, I had 2 of those test question tips, you know, and whenever I got anxious or something like that, I would just start reading these, pulling these out. So I also had vaccinations. That was a big one. I was just really worried about those. Women's health, I have women's health on like menopause and BV and how soy or isoflavonoids mimics estrogen. Sometimes somebody might give you an issue saying that they have complaints of they feel like they're pregnant but they're not or something like that. And then when you look at their diet, they're like vegan and they only eat soy. Or maybe men might be having that problem, right? I think I put it right here. Tea time with tea. Let me just be sure. Yep, that's the one. Tea time with tea. You'll be able to see it. If you can, please flood my like button. You know, beat up my like button. It's been a bit neglected lately. So yeah, this one is it. I'm gonna put a little happy face. Love it. All right. So I even gave myself a time to finish my flashcards. I like checking things off, as you can see. And if you're someone that likes checking it off, if you're the kind of person that likes to write something down when you're test taking, some individuals and studies have actually showed that you are able to read something and comprehend it and actually keep it in your mind stronger if you have it in paper as opposed to on the computer, right? And when it comes to me, the amount of ADD I have, I'm I'm a student, same as you. So we're always going to be a student in life. We're always going to be learning more, and I love. Oh, yay! Thank you, guys. Thank you, Ms. Tanya. All right, so we also have geriatric. Talk about like community acquired pneumonia. That's going to be a kind of individual you need to remember. If they're older than 65, just know that you're going to have to give macrolides or azithromycins. You know, HEENT, head, ears, eyes, nose, throat, just all that. Understanding it. Different kind of anemias, like thalassemia, are for people in Greece, but also some people of the Asian variety, right? B12, you know, the pernicious anemia, the tingly fingers, versus the folic acid, which is the alcoholics, right? Because their meals are replaced by the alcohol. We have cardiac, which is S1 versus the S2 sounds, and how the mitral valve and the, oh my gosh, we can go through the cardiac system. So fun. It'll become second nature. I would love to talk about that. Right. The way that I remembered it, it says motivated in apples. Okay, here. Motivated apples, right? And that's for mitral, tricuspid, and the AV valves. Motivated, the word, it literally has it. And in apples, you see the aortic, pulmonic. Oh, this is going to be great. I can't wait to teach you guys this one, right? If you guys want to take a screenshot really quick, I'll show this one more time. This is an awesome way I learned about cardiac. I wrote all the labs down. I wrote motivated apples. And they're like, motivated apples. If you know, you know, right? Okay, like the sounds of the S3, the CHF, that's Kentucky. That's how it sounds, Kentucky. As opposed to S4, that sounds like Tennessee. Kentucky, Tennessee, right? If you're able to remember this, it's still kind of confusing until you lose your mind and you're like, oh my gosh, I hear it. Oh my gosh, I hear it. That'll be a good one. As well as the bell tone and how you have, what do you use the bell tone of your stethoscope for? Is for S3 and S4 sounds. They might ask that question. More cardiac. I want to see, soon enough, we're going to probably have like a poll in the discussion board, and we're going to see what do we want to have a cramp session on next, cardiac or STDs or pulmonary. A lot of fun ways of remembering a lot of these. Dermatology, non-clinical question, like they did ask me a non-clinical question. They asked me a question about when an individual has an end of life, and you know, some situation like that. And I believe I got it right because they didn't ask me any more questions about it, thankfully. What I put here is like Nurses Practice Act, and the state is the rules, and the Board of Nursing enforces the rules. Just individuals like that, first party, second party payers. They didn't really ask me anything about these. It was just mostly HIPAA, end of life, DNR. That's what they asked me. I color coordinate things. I do everything to remember it. If I can sleep on a book to remember it, I would, but I don't think that's been invented yet. I have PEDS development, right? Like the different growing of things, because I didn't have a child, so that was very a weak spot for me. When a kid walks, when a kid stands, you know, when a kid says hi, side to side talking, you know, good things like that. Pregos, I definitely had pregos. Whew. Preeclampsia and everything like that. Placenta previa versus abrupto, which is the way I differentiated it is that abrupto has pain, whereas previa is painless. Abrupto, acute pain. Previa, painless. I was over there singing, and they had to tap on my shoulder like, during the you're interrupting individuals. Remembering how to calculate someone's pregnancy. They're going to ask that. I put the plus 7 days minus 3 months. Easy. Don't be dyslexic and flip them around like I did. But luckily, one of the questions helped me correct my notes, or else I would have gotten a few of them wrong. Right? We have the psych one, which I had all kinds, which I'm going way deeper into it now. Research, evidence-based practice. They might ask about that because they want to know that you understand the hierarchy of necessities and how they found these answers. Right? You got to be on board. I also have STDs, and then it restarts from the beginning of, I have BP, pharmacology, acne, and another HENT, which I think I spilled some tea on this one, but I was really getting into it. But yeah, this was really fun. So if we want to have a little of a study cram session, either on making these or on any of the topics from below that anyone feels that they don't have on hand, I'm going to be going through all of them either way when it comes to clinicals and stuff like that, where We're going to be learning how to do catheter insertions, or putting in a urinary catheter, or, you know, maybe even NG tubes, or checking each other's ears, everything. It's fun. We're testing each other. We're finding reasons to poke and prod and assess. So let's go over a few questions now, just to be able to put into effect the tips that I gave us. Right. So when assessing a client for signs of a stroke, which of the following are priority assessments? This is a SATA. Select all that apply. So the answer is, the answers are: A, monitor electrolytes; B, assess for hematopoiesis; C, assess for EKG abnormalities; D, assess for aphasia; and E, assess for facial drooping. So all of these are select all that apply. So now, instead of getting overwhelmed and trying to remember, like, I calm myself down and now this is truth or false. When you're assessing for signs of a stroke, are you going to monitor electrolytes? No, that's not what we're doing first. Are you going to assess for hematopoiesis? First of all, what is hematopoiesis? Is one-sided weakness. So you're going to ask them to smile. Hematopoiesis. Are you going to assess for EKG abnormalities? At this moment in time, a stroke is a neurological issue. It's not a heart attack, so we would not be checking for EKGs. Though he might start getting scared when he realizes what's going on. But at this moment in time, that's not what we're looking for. So that is not it. That's a false. Are we going to assess for aphasia, which is inability to move their mouth or talk? Yes. And are we going to assess for facial drooping? Yes, that was the question of smile for me. So the answer is aphasia, facial droop, and hematopoiesis. There we go. We just answered a SATA, right? Perfect. Why is the answer the way it is? Because we focus on neurological signs and we did not prioritize the EKG or electrolytes, right? A nurse is becoming certified in stroke care, and the nurse understands that in the FAST mnemonic, and if we were over here trying to remember what the mnemonic for FAST was, there's the answer. Like, don't go ahead and try to look for it right now, but keep it in mind, and then if we have time, we'll go back and we'll try to find it, right? So FAST, what is the mnemonic for FAST, and what does F stand for? Feet, face, fast, or form? Then the answer is fast. I don't know. It's feet. Yeah, it's feet, fit, fast. I don't know about the answer specifically. I got it online, but right, that it answered your question for another one. If you can see, there's like a horde or a murder of crows. Either there's a body somewhere soon, or it's just beautiful. The nurse is providing education to a client who is newly diagnosed with diabetes mellitus, right? It doesn't specify diabetes mellitus 1, diabetes mellitus 2, because in my head, I'm like, tell me which one it is. And then I can tell you if they're young or if they're old. I can tell you how they got it. But that's not the question. The patient is newly diagnosed with diabetes mellitus. Which of the following should the nurse emphasize? Select all that apply, right? This one, the answer is not even here. So I'm going to ask people to use the chat and help me answer this. I'm going to use it as truth or false. Which of these should the nurse emphasize? A, wearing proper fitting shoes. Is this something that needs to be emphasized with diabetes mellitus?
Yes.
Yes. Right. Cut toenails with round corners.
No.
False.
Yes. False, because diabetics are not supposed to be cutting their nails. It should be filed, and maybe by someone else. Inspect feet daily. Truth or false?
Yes. Yes.
Yes.
Don't walk barefoot.
Yes.
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 Yes. True.
Use a heating pad to keep the feet warm.
No.
False.
False. There you go. So the answer of this select all that apply is wear proper fitting shoes,
Yes.
inspect the feet daily, and don't walk barefoot. These are the three that the nurse should emphasize. Boom. Right. Of course, we're not going to do the heating pad. Why? Because sometimes these individuals are going to have decreased sensation and they could low-key burn themselves and not even realize it. Awesome, everyone. Thank you.
Teresa, we really appreciate you.
Yes. So are we ready for about like 5 more questions, or are we completing the class for the day? How are we
Yeah,
That's
yeah,
fine. We're ready.
More
We're ready
questions.
for that.
Yes, bring it on. They're ready for more questions. That's
Yeah.
awesome.
Okay. Alrighty. So let's see. All right. So going on with questions. The child with a seizure disorder is being treated with Dilantin, also known as phenytoin. Sometimes the questions are going to have both generic and brand name. Though it is easier to learn the brand name because it sounds cooler, it would behoove you to know what the other name of it is. I like the generic more because everyone saves more money on it anyways, right? So it's Dilantin and phenytoin. The child with seizure disorder is being treated with Dilantin or phenytoin. Which of the following statements by the patient's mother indicates to the nurse that the patient is experiencing a side effect of Dilantin therapy? All right, we're going to remember medications now. We're going to remember that this is a seizure medications, and there's only like 2 or 3 of them. And which one does this one stand for? You know what this reminds me of? Remember in which one is it? Something like that. No, Powerpuff Girls. And the neighbor had like a wife that looked like this. She had this. It's called gingival hyperplasia. Just remember that. So, A, she is very irritated lately for Dilantin. B, she sleeps quite a lot, quite a bit of the time. C, her gums look too big for her teeth. And D, she gained about 10 pounds in the last 6 months. So because we know that Dilantin, I think of Dilantin like Dylan.
B.
Yeah, it's C. So her gums look too big for her teeth.
got it.
I don't know. So gingival hyperplasia is gums associated with Dilantin therapy. It's something that if someone starts to have it, they might have to just be very careful because their gums are sensitive, or they can even switch to another medication if they don't like what's happening. So the next question, let's see. A 5-year-old is admitted to the unit following a tonsillectomy. Which of the following would indicate a complication of the surgery? Right? A, decreased appetite. B, a low-grade fever. C, chest congestion. Or D, constant swallowing as a complication of surgery.
Yeah.
Constant swallowing.
Constant swallowing.
D,
Why
yeah.
so?
Because of the surgery, and they will not be able to aspirate. The patient will aspirate, and they will not be able to swallow food for nutrients.
Good job, Ismail. How you doing? Yay!
Good. I don't.
So yes, he is correct. A complication of tonsillectomy is bleeding, and constant swallowing may indicate bleeding. And though you don't see him coughing it up, you have to notice it because the child probably doesn't even know that this wasn't telling you this. Or you can educate the mother that if you see the child swallowing, you know. A decreased appetite is expected after tonsillectomy, as is a low-grade fever. Thus, answer A and B are incorrect. And C, chest congestion is not normal. It is no way, shape, or form associated with tonsillectomy. So good. Everyone saw what the danger was right then and there, bleeding. So which classification of drugs is contraindicated for the client with hypertrophic cardiomyopathy? Hypertrophic cardiomyopathy. So we understand hypertrophic, the heart muscle has gotten big and has led to a disease process. So positive isotropics, this one's going to be difficult because not everyone probably knows what positive isotropics is, but this is where we're going to use the look at which one looks the same and which one looks different. If you know 3 of them, if you don't know one of them, that might be the answer. Okay, so positive inotropics, vasodilators, diuretics, or antidiuretics. Which classification of drugs is contraindicated for a patient with hypertrophic cardiomyopathy? Now, this is an understanding of the disease process of the heart and what kind of medications they would need, right? So, a positive inotropic agent should not be administered owing to the action of increased myocardial contractility. An inotropic allows the heart, vasodilator would allow the blood vessels to vasodilate and to allow for less strength on the cardiac load, right? Diuretic would allow for a release in fluids for less of a cardiac load, right? And antidysrhythmics, right, is going to be used to prevent them from having an actual EKG issue, right? That does not have to do with hypertrophic cardiomyopathy. So now that we know that inotropics, positive inotropics, is only going to increase the positive workload on the heart, what's contraindication? Do you get it? The answer is positive inotropic. That one is contraindicated for someone with hypertrophic cardiomyopathy. If you get me started with drawing his heart, we're gonna be here for another hour. So we're gonna make this into a specialized class when it comes to cardiac, because this can be very fun. The cardiac for me, it's like a part of the car that you can't do without. It's basically the engine. You can change a tire, but here people are trying to push the heart to a All right, here's an interesting one. You probably don't need to understand the entire definition or the entire disease process of this, but let's see if you can answer it, right? Signs and symptoms of an allergy attack include which of the following? Wheezing on inspiration, increasing respiratory rate, circummoral cyanosis, or prolonged expiration. So I'm going to act it out. Wheezing on inspiration. Which of these is going to be the symptom, right? Because there's different ways, right? So someone wheezing this way might make me think that there's something blocking the airway. Maybe a kid swallowed a cap or something like that. If someone's increasing respiratory rate, you can breathe really fine. It seems like you're having a panic attack, right? And then the circumcyanosis is meaning that they're gonna have like blueness around the lips or something. That's not the answer. So it's prolonged expiration. It's and imagine them trying to breathe in there. So this is the meaning of me characterizing this individual. You can see them. That person's having an asthma attack. It's not the increased respiratory rate. It's the prolonged expiration. Why? Because when wheezing occurs during the expiration, the air movement is impacted, right? So then now there's something called dead air entrapping, and that's why it takes them so long to get oxygen out. So the answer to this question, we're going to do it again. Signs and symptoms of an allergy attack. A, wheezing on inspiration. B, increased respiratory rate. C, cyanosis. Or D, prolonged expiration. What's the answer?
Cyanosis.
No, it's prolonged expiration. Prolonged expiration.
Prolonged expiration.
Yes. Cyanosis just means that you're becoming hypoxic, which yes, it is something that happens when someone becomes, induced with an allergy attack. But the sign and symptom that specifically is prolonged expiration. We're just going to remember this. It's going to be great. Don't worry. Sometimes when I get an answer wrong, it hurts so much that I'll never get that answer wrong again. Right? You see, we have a few minutes left because my battery timer is giving me like 5 minutes. All right, let's see if we have one more good question. A client confides to the nurse that he tasted poison in his last evening meal. This would be an example of what type of hallucination, right? Oh man, they poisoned me, whatever. So now we're going to be documenting this. We can say, oh, as per patient, quote unquote, he says they tried to, because it is very important to put these things sometimes. The patient is known to have hallucinations, and he has stated someone has put something in my food, or I believe someone has put something in my food as per patient. What kind of hallucination is this? A, auditory. B, gustatory. C, olfactory. Or D, visceral. What type of hallucination is tasting?
Can you please repeat them again?
A, auditory. B, gustatory. C, olfactory. And D, visceral. Which of these?
C.
C, olfactory. Olfactory involves the sensory of smell. Smell, but it's very close, very close. Gustatory, Gustator. Gustatory is the hallucination involving the perception of taste.
Okay,
Right?
that's right. Okay.
Here, I'll spell it out, and we can definitely do this again.
That.
Great. And don't worry, this is us learning amongst each other. There's never a time that it's a bad time to answer a question. I love the fact that we're trying. I love the fact that we're working on it. And if you find yourself not answering a question, you can write it down, and now you know this is a topic that I should learn about. It's always a learning for ourselves. Okay, the only time it's going to be bad to get it wrong is when we're actually taking the NCLEX. When we actually spent money on that, and we want to get it right. So we're going to go ahead and start ending this for now. I look forward to us having another one of these sessions. Everyone have a great day. Thank you for your time today.
And don't
Thank you,
forget to
Miss
so much.
Teresa.